and parents really underestimate the impact that their own emotions and anxiety can have on their children. So it's really important to keep that in check. And one of my former PhD students, Megan McMurtry, who's now a professor at Guelph, she had a fascinating dissertation study where she looked at exactly this. So there's been a lot of research that's looked at the relationship between different types of parental behaviors and child pain and distress during needles. So one of the sort of best known findings is that when parents reassure their children during a medical procedure, so it'll be over soon, you're doing great, that has actually been related to increases in child pain and distress during the procedure, which is a bit counterintuitive.
Yeah.
And so Megan did a series of studies to try to figure out why would reassuring a child make them feel worse? That's not the parent's intent. And interestingly, Megan found that when parents reassure, like it'll be okay, they're doing it because they themselves are feeling anxious or worried. And she did a series of experimental studies to try to get at this, but was able to show that when parents reassure, children perceive their parents as anxious. And that is sort of what drives the increase in their anxiety and pain during needles. So for parents, some of the best things that parents can do when their children are having procedures are using distraction techniques. So, okay, let's focus on something else. Let's count the tiles on the wall. There's lots of different things you can do to distract, give specific suggestions on coping strategies. Let's take a deep breath together. And then also just using humor when appropriate to try to just make the situation feel a little lighter.